Hello class, this is Dr. Branch. Today we're going to discuss what is an abortion. An important step in determining one's moral stance on an issue is understanding exactly what it is we are discussing. So I'm going to take a few moments and describe for you some abortion procedures. These are rather gruesome, but it is important for us to have a clear understanding of the nature of the act we are discussing if we are going to arrive at a moral stance. So let me point out one thing to you. You hear lots of language about trimesters in discussion about abortion and development of the baby. This gives you a timeline for trimester. Typically, the first trimester is from 0 to 13 weeks. The second trimester is 13 to 28 weeks. And the third trimester is 28 or 29 weeks until the baby is born. So I'm going to give you two categories of abortion. Basically, there are pharmaceutical and surgical abortions. So when we talk about abortions and how people actually end a pregnancy, they can be divided into two categories. Pharmaceutical means the use of some sort of drug, and then a surgical abortion means that some procedure has been performed that intrudes into the woman's body in a surgical way. So pharmaceutical and surgical abortions. Sometimes you'll hear about spontaneous abortions. This simply means a miscarriage, which sadly occurs because of living in this world. Now, there are three moral categories of induced abortions. Now, I've told you there are two broad categories for how the procedure is done, pharmaceutical and surgical. Now we're talking about the moral reasoning behind induced abortions. The first is a therapeutic abortion. These are performed to save the mother's life. I'm going to provide some notes for you about ectopic pregnancy. An ectopic pregnancy occurs when the baby implants in the wrong place, most commonly the fallopian tube. An ectopic pregnancy will not come to term. It will reach a certain point, burst, and begin to bleed profusely. Listen carefully, in an ectopic pregnancy, the baby is not going to live. You can't save both lives. You can save one life, the life of the mother. I know of no Southern Baptist ethicist that believes that sin has occurred when an ectopic pregnancy is ended. Now, the challenge is when you and I talk about the life of the mother, this is what most Baptists have in mind, an ectopic pregnancy. But remember, secular people, when they talk about the life of the mother, they have very broad categories. Go back to my notes on Doe v. Bolton, and you'll see that. But as Christians, when we refer to life of the mother concerns, we're talking about an imminent, dangerous risk to the mother's life. Eugenic abortions are a different category. This is where there is some perceived defect in the child. For example, Down syndrome babies. I have that misspelled. It should just say Down syndrome. But Down syndrome babies. And the vast majority of babies who are diagnosed in utero with Down syndrome are aborted. This is horrible. This is a genocide. But then the vast majority of abortions in the United States are elective abortions. They are performed for matters of convenience. So when we are talking about the morality of abortion, what I want you to remember is this: about 93% of abortions do not fall into the hard categories. Some of you are thinking about rape and incest. Those would typically fall under elective abortions. But if you put aside therapeutic abortions, eugenic abortions, and then rape and incest abortions, about 93% of abortions in the United States are purely for matters of convenience. They're performed for financial reasons, or the baby just gets in the way or something like that. So let's say a few words about pharmaceutical abortions. These use some combination of drugs to induce an abortion and are non-invasive methods. That means no surgery is performed. And a drug that causes an abortion is called an abortifacient. I use the term pharmaceutical. Wikipedia uses the term medical. Lots of sources use the term medical. I have found that confusing to my students, and it's easier for my students to conceive pharmaceutical, someone's taking a drug. So also known as medical or chemical abortions. The most common form is Mifeprex. That's the brand name, and that's what you need to know for the exam. It was originally called RU46, but it's known by the brand name Mifeprex, and it is specifically designed as an abortifacient. And so what it does is it affects the progesterone receptors within the woman's body that are necessary to keep a pregnancy, and it causes the baby to detach from the uterine lining, from the endometrium, and so this causes an abortion. So it's a 3-step process. During the first visit to the abortion provider, the pregnant woman takes the mifepristone, the RU46, the Mifeprex, takes the drug, and then at a second visit she takes misoprostol, which causes her to basically induce labor and expel the dead baby from her body. And then about 2 weeks later, there's a follow-up exam done to make sure the abortion is complete. Now, listen carefully. Mifeprex is wrongly called a morning after pill by many of my students. Listen carefully. Mifeprex is not a morning after pill. The morning after pill is more appropriately referred to as Plan B. I will provide you some notes about contraception. Plan B is an emergency contraception. We're not talking about that in this lecture, but just remember, Mifeprex is not properly called a morning after pill. That would be Plan B. So some other pharmaceutical abortions you see there. Most of these are not used nearly as frequently as Mifeprex, so I'm just going to scoot past them. Now let's talk about surgical abortions. There are several kinds. I'm going to list 7. A couple of them you'll need to know for the exam. A few of them you'll need to know for the exam. So first of all, surgical abortions require some type of intrusion into the woman's body. A surgical instrument is placed within the woman's body. Her cervix is dilated in some way, and implements are placed within her uterus. So, the first is menstrual aspiration or manual aspiration. This is for very early pregnancies, 1 to 3 weeks after a missed period. And it uses really just a manual suction device that looks something like this, right there. So many pro-abortion advocates are suggesting this as an option in third world countries for midwives and nurse practitioners and things like that. And here in the United States, some are advocating early abortions can be done using this method by nurse practitioners to try to keep the price down. So it's 1 to 3 weeks, and basically what happens is the baby is manually sucked out at a very early stage in pregnancy. That's manual aspiration. Now, when most people think of an abortion here in the United States, they're thinking of a suction abortion or a suction curettage, also known as a vacuum curettage, and it's a very violent procedure. It's the most common type of abortion. These numbers are changing. I say 80% here, maybe more like 75% with the increase of pharmaceutical abortions in first trimester, but somewhere 75 to 80% of first trimester abortions, and the vast majority of abortions in the United States occur in the first trimester. So the developing baby is removed by a suction device that is inserted into the uterus. These abortions can be done up to 13 weeks of pregnancy. Some suggest maybe just a bit beyond that. So this is what happens. The lady's cervix is dilated. The suction device is placed into the cervix. The baby is sucked out into a jar. It's possible to still see body parts there. Then the curette is placed in to make sure there's nothing left in there. And this is called a suction curettage abortion. So to be clear, the developing baby is sucked into pieces into a jar. It's a violent act. Just so we have some perspective, this is what a baby looks like at 12 weeks. Dilation and curettage, I don't want to say much about this. The World Health Organization says this is an obsolete method of abortion and believes other methods should be used. So I'm going to scoot past it. Saline injection. This is rarely done in the USA anymore. If you read a very widely used ethics text known as Ethics for a Brave New World by the Feinberg brothers, which is a fine book, they refer to this as the most common form of second trimester abortion. That may have been true 40 years ago. It's not true anymore. But it is horrid. A needle is inserted into the water bag surrounding the baby, the water sac, the placental fluid. Some fluid is removed and then replaced by a concentrated salt solution, and a baby is burned and poisoned to death. And this is at an age when children most certainly can feel pain. All the pain receptors are there. It is horrid. And this is the idea, just to give you some idea, the needle is inserted and around the amniotic fluid, salt solution is placed, and it burns a baby to death. This is Gianna Jessen. You can follow her on Twitter, but she survived a saline injection abortion when her mom was 7.5 months pregnant. So there have been stories of babies being born alive after these saline injection abortions, and then they're just left to die. But she actually survived. The next page I want to show you is very horrid, and it is disturbing, but I want you to see the nature of the act we're talking about. This is from Jessen. This is what a baby looks like after a saline injection abortion. Dilation and evacuation. The cervix is dilated manually with rods, and then instruments are used to crush and remove the fetus piecemeal. This is the most common procedure for ending a pregnancy between 14 and 21 weeks. It is similar to a suction dilation and curettage, but with much larger instruments. So here's one idea of how it works. The curette is placed in, and the baby is ripped apart piece by piece. Just so you have a picture of what's going on, arms are ripped off, legs are ripped off, the body is torn apart, and the baby is then pulled out. And frequently what happens after this part is a suction device is placed in there to go around and make sure that everything, all the baby has been removed from the uterus. This is a horrid procedure. This is a second trimester procedure. Hysterotomy, this is not used that often, but it's basically the same thing as a C-section, only with the purpose of killing a baby. And finally, partial birth abortion, which is now technically illegal in the United States. This is a wretched, wretched act. Developed by a guy up in Nebraska here, Carhart. But this horrid method, also known as dilation and extraction or dilation, is performed in the second or third trimester, and the baby is intentionally turned around breech where the feet come out first by the abortionist. Then the abortionist pierces the baby's skull, and the brain is sucked out. Now, I'm unclear on the legality of this in other places in the world. What I know is it is now currently illegal in the United States. But just to give an idea of what this is like, the baby intentionally turned around and delivered breech. And then notice this, the back of the skull is pierced, and the brain is then, typically what happens is the brain is then sucked out and the baby dies. These are horrid, horrid acts. Now, I'm going to scoot past several notes. You can read my notes, and you can look at my PowerPoint for a lot of information about abortion procedures. But I'm going to scoot on to the end and say a few words about Planned Parenthood, one of my least favorite organizations in the world. And let me say a few things because of a lot of debate today about the degree to which Planned Parenthood is funded by our tax money, which I find patently offensive. It's grossly offensive. So just so you know, it was founded by Margaret Sanger, and yes, she was a eugenicist. Yes, she had racist overtones. She is one of my least favorite Americans ever. She was originator of the term birth control. She actually opened her first clinic in 1917 and the American Birth Control League in 1921, and later changed its name to Planned Parenthood. So about a little over 100 years old now. Here's one of her famous quotes. I have this book on my shelf, Woman and the New Race, and she says, "The most merciful thing a large family does to one of its infant members is to kill it." That gives you some idea into Margaret Sanger's mindset. Now, it is actually here in the United States a federation of 85 different affiliates around the U.S., and together they operate around 820 different offices around the nation. Got one not very far from the plaza right here in Kansas City. So it's the largest abortion provider in the United States, and they began getting federal money in 1970. One more reason not to like Richard Nixon. But for the fiscal year that ended on June 20th, 2014, the group received $528 million in federal funds from you and I. So they performed 327,166 abortions in the year that ended September 30th, 2012. In fact, they are meticulous and precise in their documentation of how many abortions they do every year. Now, a couple of years ago, a lady named Dr. Deborah Nucatola, who was at that time the Planned Parenthood Senior Director for Medical Services, was caught on a video bragging about how she aborts babies in such a way that their body parts and organs can later be sold for profit. And here's a direct quote. These intrepid young pro-life video producers caught her on video, secret video, and she said, quote, "We've been very good at getting heart, lung, liver because we know that, so I'm not going to crush that part." And she's talking about this dilation and extraction here. You see what she's talking about now. She's got that forceps and she's ripping off a particular pace the baby that she wants to keep, but trying to be careful around another place that she's going to sell. I'm going to basically crush below, I'm going to crush above, and I want to see if I can get it all intact so she can sell these parts that come out of the torso. And what I find most disturbing is she's discussing dismembering tiny humans while sipping red wine and having a nice lunch. This is the sign of a conscience that has been seared and no longer works. And I would remind you, the Apostle Paul says the conscience can become seared as with a hot iron, and it does not work anymore. So this is what abortion is all about. It is ripping apart, dismembering, and sucking into jars tiny human lives.